So this afternoon, Jan Gardner and her exec colleagues Eddie and Chris were able to join us at University Hospital Hairmyres to review some of the progress that we've made as part of Operation Flow and Operation Flow 2. It's been really wonderful to show her some of the good work that we've been doing on site, including some of our plans for the future and how new models of care in the emergency department are going to transform our front door, how the Flow Navigation Centre is innovating and testing changes on an ongoing basis to improve the interface between primary and secondary care, and talk to some of our consultant colleagues about how these work streams are affecting them and their working lives.
This was a really good opportunity for the medical teams to explain to Jan how Operation Flow and the fire break helped them and give their opinions as to how we can move forward with further progress with Operation Flow.
Jan and the team visited the Flow Navigation Centre, and there's a huge amount of work that's going on in the FNC and the team. I think the opportunity to share the work that's going on, and there's the collaborative work between primary and secondary interface, just to talk through and share what the developments and share the next steps has been really beneficial to staff. So they can actually showcase the work that's already ongoing, but also talk through the plans for the future.
Today, together, we reflected on how we can better engage the multidisciplinary team in developing the ideas and harnessing some of the initiatives that exist across the board to improve the way that Operation Flow runs, improve some of the things that are being done as part of Operation Flow, and improve the way that communication happens as part of Operation Flow as well. And that's something that we really need to work on as Flow 2 carries on and as we move into the phase of Operation Flow 3.
And collectively, we need to listen to all of our staff groups to understand how we can engage so that they can have a voice, because it's essential that all of our staff have a voice. It's difficult for all staff to feel that they are being heard, but we need to listen and we need to learn and we need to work with our colleagues so that everyone has an opportunity to be involved in Operation Flow 2, Operation Flow 3, and for us as a site in Hairmyres.
So we'd love to hear everybody's views on this, and we would encourage everybody to engage with ourselves through in the usual fashion, through your ward meetings, your team-based meetings, and further visits and roadshows from the exec and board teams.
It's really 13 weeks to the start of winter, and each year we know the pressures on our site, on our staff and our patients. This year we are preparing early, we're pausing, we're reflecting, we're looking at processes from our patients coming into the hospital, pre-admission, and our processes within the hospital. So there's a massive staff engagement looking at all of these different measures. In terms of recruitment, we are actively recruiting. We have our newly qualified practitioners starting with us in the next couple of months, and we will be actively recruiting again in the autumn. So this year it feels that we are preparing in advance rather than reacting to the situation that we've had to do over the last couple of years in terms of the pandemic.
So we're looking forward to caring for patients in a slightly different way this year, and managing the flow of patients better and differently. And we're looking forward to embracing our staff, hopefully more holistically.